Hey guys, thank you so much for watching WellnessKE. My name is Fatma. Here on WellnessKE, we like to offer women great information and solutions to help them balance their hormones through fitness, nutrition, and also a holistic approach. Welcome to the second part of our conversation on fibroids. In this video, we're going to talk about the types of fibroids, the signs and symptoms of fibroids, and most importantly, what tests your doctor is going to run to ensure they detect the fibroids. Keep watching. So, fibroids are actually categorized based on their location. So, where they are located in the uterus, that's how we can know the type of fibroids that you might have. So, your doctor is actually going to ask you for your signs and symptoms. Then they're actually going to run some imaging tests so that they can be able to find out where the fibroids are located. But for the sake of this conversation, let me share with you the types of fibroids. We have fibroids that are located outside the uterus. We also have fibroids that are located inside the uterus, and there are fibroids that are located within the walls of the uterus. Fibroids located on the outside of the uterus are known as subserosal fibroids. The ones located on the inside are known as submucosal fibroids, and the ones located within the walls are known as intramural fibroids. Something else I want to mention is that there are some fibroids that are known as the pedunculated fibroids, meaning when they are attached to the uterus and where they are attached, there is something like a stem or a stalk that holds them and they grow outward. And these are fibroids known as pedunculated fibroids. And if you have a fibroid that is a non-pedunculated fibroid, it means it is not attached to any stem. It's basically just attached to the uterus. So, as I mentioned, fibroids are actually diagnosed or categorized based on their location. So when you share your signs and symptoms with your doctor, they're going to send you to a radiologist who's going to run some tests. And once the tests come back, they're going to be able to determine what type of fibroid that you have. And also, these type of fibroids actually show different kinds of signs and symptoms, okay? Some people who have fibroids on the inside or the inner part of the uterus tend to have certain types of signs and symptoms, and those who have fibroids going outward tend to have certain types of symptoms. So right now, let's walk straight into the signs and symptoms of fibroids. So, what are the signs and symptoms of fibroids? The first one is heavy menstrual cycle. So, women who have fibroids tend to have very heavy periods, and this is something that can actually cause problems later on. Another symptom is prolonged periods, meaning instead of them having, like maybe 2-3 days of their cycle, they end up having them for 7 days, sometimes even longer. And this leads me to my next symptom, which is anemia. Because of the heavy periods and because of the prolonged periods, then women who have fibroids tend to have lower levels of iron and also have anemia. Another symptom of fibroids happens to be a distended abdomen, especially for the fibroids that are located outside the uterus, the subserosal fibroids. So the tummy appears as if a woman is pregnant. And I can share this because this was actually the situation with me. So this is one of the signs and symptoms of fibroids. Another one happens to be lower back pain, because the fibroids do cause a lot of pressure and they do exert a lot of pressure onto a woman's body. So this can actually cause lower back pain. Another sign and symptom of fibroids happens to be pelvic pain or pelvic pressure. And this pelvic pressure, especially for women who actually have large fibroids, the fibroids actually exert pressure in their pelvic area, and this actually leads me to another sign and symptom, which is frequent urination. Because of the pelvic pressure, women tend to actually have frequent urination. So this is one of the signs and symptoms. Another one that's actually quite common is painful sex. This is another sign and symptom of uterine fibroids. And another sign and symptom of uterine fibroids happens to be constipation. So irregular bowel movement. This is one of the signs and symptoms of fibroids. Another symptom of fibroids happens to be infertility or subfertility. It's important for you to speak to your doctor about this one if you have been diagnosed with fibroids, because this is actually linked to the position of the fibroids. Sometimes some fibroids are positioned in such a way that they actually disrupt or they cause some kind of mechanical distortion, such that, a woman's body or a woman's reproductive organs are not able to, conduct the normal procedure that happens in order for you to have a baby. So it's important that you talk to your doctor about this one. And finally, another symptom of fibroids happens to be bladder issues. Because of the pressure on the pelvic area, this actually happens to be another sign and symptom of fibroids. So now that we know the signs and symptoms of fibroids, it's important for us to know, once you are at the hospital and you're talking to your doctor, how are they going to be able to find out the kind of fibroids that you have? So let's talk about that. So it's important for you to talk to your doctor so that you can be able to explain your signs and symptoms, and this way they can be able to know what kind of tests they're going to run in order for them to know what type of fibroids you have. So right now I want to walk you through the different kind of imaging tests that doctors are going to use, or the radiologist is going to do, in order for them to find out the type of fibroids that you have. So the first type of imaging test is known as a transvaginal ultrasound. A transvaginal ultrasound is basically going to be used to detect fibroids that are located either inside the uterus or the walls of the uterus. So the second kind of imaging test is known as a transabdominal ultrasound. A transabdominal ultrasound is probably the most common type of ultrasound. If you've seen videos of women who are pregnant and you've seen that the radiologist actually applies some type of gel and actually uses a certain object to check for the baby, this is quite similar to, the kind of ultrasound that a woman that has fibroids is going to have done. So this is actually the transabdominal ultrasound, and it's used to check for fibroids that are located outside the uterus and also fibroids that could be located within the walls of the uterus. Another type of imaging test is known as an MRI. An MRI scan is actually going to be used, and it's good for detecting the location of the fibroids, because also knowing the location is very important to know the kind of treatment that your doctor is going to prescribe for you. Another kind of imaging test that's actually very important for us to know is also known as a hysteroscopy. And this hysteroscopy is actually a kind of ultrasound that is used to detect fibroids that are located inside the uterus, the type of fibroids that are known as the submucosal fibroids. Another type of imaging test that is used to detect fibroids is known as a saline infusion hysterography, and this one is actually used to detect fibroids that are located inside the uterus. So we have these different kinds of imaging tests that a doctor is going to be able to prescribe so that you can be able to know the type of fibroids you have, where they are located, and that way you can know the type of treatment that is best for you. Now that we have this important information, let's discuss your treatment options and why you should pick certain treatment options for fibroids. So we've come to the end of our second part of the conversation on fibroids. I just want to remind you that if you haven't watched the first video, you can click right here. And remember, our next video will be right here. And speaking of our next video, we're actually going to be talking about treatment options for fibroids, also factors to consider when you're thinking of your treatment options, and most importantly, ways that you can manage fibroids. So make sure that you watch.